Well, welcome everyone to the 27th Degree with Chris and Nancy from 27 Degrees Consulting. Today we're really excited to have Dave Gering with us. Dave works for Medicare Made Easy, and he's going to talk to us a little bit about Medicare. Before we get into that, though, I want to also recognize our sponsor, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoastbank.com or call 508-678-7641. So, Dave, why don't we start? Maybe you can just tell us a little bit about yourself.
Well, thank you very much for having me, first off. I'm excited to be here. Medicare is a confusing subject, so
Sure.
hopefully I can clear up some confusion for some. I've been doing this for a little over 5 years now. I represent many carriers in Rhode Island and Massachusetts as well. So in Massachusetts, I represent everyone but Blue Cross. In Rhode Island, we represent all the carriers that offer Medicare plans in Rhode Island.
Nice.
Very good.
So, when we were kind of talking about Medicare and how confusing it is, and we get a lot of feedback from our patients or someone in our family, or my husband who's much older than me, kind of like your age.
Wow, that's old.
You're supposed to say that.
So, Chris is actually younger than me. But, it's like, where do you even start? Where do you begin? Even with signing up. I mean, I've heard that you automatically get enrolled in it if you're collecting Social Security versus you have to actively sign up for it. And then it's like, when do you sign
Yeah,
up
what
for
happens
it?
when someone gets to around that age? What's the process, Dave?
Well, it depends on, are you collecting your Social Security? Did you take your Social Security early? If you did, maybe you don't need to contact them to turn on Part B. Otherwise, I would recommend, contact Social Security 3 or 4 months prior to your 65th birthday. Or sit with someone like myself who's going to, explain to you how Medicare works. And if you're going to continue working, you want to see, does it make sense to stay on your employer plan? So, but yeah, there are steps to contact Social Security to get everything turned on. And it does seem confusing, but that's where someone like myself could help you.
Okay.
Oh, thank God. So now they have the Medicare.gov website too.
Very helpful.
Yeah,
Very
I
helpful.
kind of browsed on that. Can you sign up on that?
You can.
But then you're navigating things maybe you're not 100%
Well, they're not
sure.
explaining to you. They give you the details of
Yeah.
maybe a plan, but they're not going to explain it to you. And, they're not going to look up your doctors. That's where an independent person, when it comes to Medicare, the 2 important questions are, who are your doctors and what prescriptions are you on? And that depends on what type of plan you go on from there. Now, the Medicare.gov has a great tool for looking up your prescriptions for everyone. And, you look it up in Massachusetts, you plug in your prescriptions, and it will tell you there's 27 different plans for you to choose from.
Oh my God.
So it depends on what level of prescriptions you're on, what you're actually taking. So that's important to do each year.
So they're all different plans within Part A, Part B. I'm already getting a little confused. Can you just back up and kind of go over, so what's Medicare Part A, what's Medicare Part B,
Sure.
and anything else that you might?
So everyone is entitled to what's called original Medicare,
Yeah,
which is Part A and Part B.
Right.
As long as you worked 10 years or more of your life and paid into the system, you get Part A for free.
okay,
That's going to cover you if you're in the hospital.
okay,
Covers your meals in your room.
okay,
That's all. Part B is everything else.
okay,
Now, Part B is they're going to cover 80. You owe 20.
okay.
The 20% is what you want, is unlimited. So that's what you want to protect. Now,
That can
Part
be a
B-
lot in the hospital. I mean,
No,
that can really add up.
Exactly. So for 20%, now example, a heart attack costs $85,000.
Right.
If you are sitting with just original Medicare, you're going to owe $16,000. That's your 20%. Now, because you have Part A and B, Part B will cost you, right now it's $148.50, unless you made above a certain income. There's a sliding scale and it goes up.
Oh,
So that's an important question as well. So that's called IRMA. That's Income Monthly Related Adjustment Account.
I'm glad you brought that up. So what years determine that?
2 years prior to your 65th birthday, if you're an individual and you made over $85,000 2 years ago, your Part B will be higher for at least 1 year. If you made more than 170 as a married couple, same thing. And then it goes up from there.
So it is depending on what your filing status, I guess?
Exactly,
Okay.
yes.
And it stays like that throughout your entire Medicare experience?
No,
So-
once you start earning below that level of income,
Okay.
that income, that IRMA will be in place for 1 year. The following year, if you drop below, it'll go back to whatever the Part B is at that time.
Okay.
That's interesting.
So just for our listeners out here, which part of Medicare pays for hospitals, which pays for doctors, which pays for medications? I think getting to some of the basics may be helpful.
Okay. Now, A is for your hospital stay. B is all your medical, other than your room and your meals. So they pay 80, you pay 20.
That's the doctors, that's the
everything.
procedures, all of that stuff.
Everything other than your meals and your
Got it.
room costs at the
So it's like
hospital.
room and board is covered by.
Exact.
Prime.
That's a great way to put it. Just room and board is covered in Part A. Part B is everything else.
Okay.
So now, when you're entitled to Part B, that allows you to pick either a supplemental plan or an advantage plan to cover that 20%, to put a cap on that 20%.
When you say supplemental plans, is that where you get into like the MedX and all that stuff?
Exactly. Those are, in Rhode Island and all other 47 states, they're leaded plans. In Massachusetts, it's different. It's Plan 1 and Plan 1A and the core plan. There's only 3 different plans to choose from, supplemental wise. So that's something you're gonna pay so much a month. You'll have a deductible if you fit that criteria. And then you'll have no co-pays for the rest of the year, whether you're hospitalized, whether you go to your doctor. So, but you're gonna put out 200 or more a month for a supplemental plan. Plus, you gotta get a separate standalone drug plan. So some people, will be on 2 drugs. Some people will be on 25 drugs. So that standalone plan can really impact their finances quite a bit, so.
All right. So say I turn 65 in 3 months, which is
It's about accurate, actually. Right? So,
nice.
Well, I'm here to help.
Thank you. Nice. Taylor, we're going to swerve the camera this way and just kind of cut him out now. But so,
Maybe I should have sat in the middle.
yeah.
we usually
maybe.
don't sit close to each other for a reason.
I know. So anyways, excuse me. So if I'm turning 65 in a couple of months and say I'm on, let's just do like a hardcore example. So I'm turning 65 in a couple of months. I'm on 2 medications, say something to decrease my cholesterol and,
Blood pressure med.
okay, good. I'm glad you said that.
Is that all right?
Yeah.
I know you were struggling, so I was trying to help you out there, Nancy.
Well, probably 2 generic pills.
All right.
Yeah, see?
2 generics.
Two
are,
generics.
Obviously, generics are minimal cost.
Okay.
Now, if you're talking 2 insulins, 2 type of insulins,
that's a
which you
different
see,
Yeah.
is out there, that's when you really got to do your due diligence and explore your cost for your meds.
Okay.
And that's where someone like myself can come in and help you.
Okay.
Doing it yourself, I mean, you can, but you can see it can get overwhelming. But that's where Medicare.gov does help.
So I would just pick the Part A, which is the same
Hospital.
for everyone.
Yep, for everyone, as long as you paid your taxes, or if you were married to someone who did.
Okay.
Maybe you didn't, but your husband or your wife did. And,
Yep.
you can piggyback that way to get your Medicare Part
Got
A
it.
and B.
And then Part B would also be dependent on maybe how many specialists I see a year and all that stuff.
Well, again, the Part B is 80-20 split.
Oh, that's right.
The specialist comes in as to whether you pick a supplemental plan or you pick an advantage plan.
Okay.
The supplement, you're gonna pay so much a month.
Yeah.
You're gonna put out a certain amount each year, whether you go to the doctor or not.
Yeah.
When you go, you're not gonna pay anything.
Okay.
You pay a deductible. Some people are in deductible, then you don't pay any copays.
Okay.
But I'm gonna spend this much.
Yeah.
The Advantage Plan, which you see Joe Namath on TV talking about every 10 minutes, all the stuff he tells you is free, it's true. Depends on what zip code you're in, depends on what state you're in. He's talking generic, but those Advantage Plans are built to where you can pay 0, you just pay as you go. If you get hospitalized, there's a certain copay. If you go to the doctor, most doctors now, all the plans, your primary is free. You go to a specialist, you have a copay of $35, $40, or $45, depends on what plan you're in. But that's where the person sitting with you needs to find out who your specialists are. And then does Harvard Pilgrim Health take them? Does
Right.
United take them? Does Blue Cross take them? Does he only take Blue Cross? He or she only take Blue Cross? So that's where someone who
Like
you're
you
sitting
can-
with, they need to do that work for you.
Yeah, Dave and I were talking about this before we started, and one of the issues I run into with my patients is, they sign up for a plan and they don't look at one of two very important things, as Dave mentioned, is, who do they have for doctors,
Yeah.
right? Because not everyone's covered on all of these plans. But the bigger thing is usually the medications. It's the medications. So they're on a number of medications, and they pick a plan, a Part D plan, which is what covers the meds, and they realize all of a sudden that their meds aren't covered, and they're paying a lot of money. So it's hard to navigate this, I would think, on your own. It's really complicated.
Well, it is, because there's moving parts. I get A and B, and then do I just get a D plan? Or,
Right.
do I just I have A, B, and D, I'm all set? You hear that?
Yeah.
Well, you're really not all set, because that 20% is unlimited. You
On
get
B, yeah.
You get a hospital stay,
Sure.
that could be a substantial.
I mean, if you have a coronary bypass or something major like that, I mean, that could be, the surgery itself, with everything could be over $100,000. So
Right.
20% is obviously a big piece of change.
Well, I use myself as an example. Unfortunately, a few years ago, I had a heart attack,
Mm-hmm.
and the bill was $85,000. So when someone comes in and says, I have A and B, I'm all set. I
Right.
say, well, you're all set until you have a situation like this, and now you owe 16.
Right.
Where the Advantage plan, most Advantage plan, not all of, all Advantage plans will put a ceiling on your maximum out of pocket for the year.
Oh.
5,000, 6,000, 7,000. So all your co-pays throughout the year, if you hit that number, you don't pay anymore.
And no matter what your income is, you can select any plan. You're not excluded from anything
Correct.
that's based on income.
Going into Medicare at 65, your initial enrollment period, the only health question they ask is, do you have end-stage renal disease?
Okay.
Which just puts you in a separate plan. It doesn't disqualify you, it puts you in a separate
Yeah.
plan, because you know the expense to take care of it.
Sure.
Once you pass your initial enrollment period, that's what Massachusetts and Rhode Island, very different.
Yeah.
Massachusetts rules compared to Rhode Island, you have a lot of flexibility in Massachusetts.
Okay.
Rhode Island, if you don't pick a supplement plan during your initial enrollment period, and you go Advantage, down the road you want to come back, there's underwriting.
I see.
They're going to ask you questions.
Yeah.
And if you don't pass, you're going to get a higher rate or completely disqualified.
Okay.
Massachusetts, if you decide to go from Advantage plan back to a supplemental plan, they don't ask any health questions.
Suppose you live in Rhode Island and your health changes. Can you move to Massachusetts
As long as your zip code is, your address is where your zip code is, you're eligible. That's why, and I've had a situation where someone was in Fall River,
Yeah.
moved to Tiverton, didn't do anything. Eventually, after 6 months, your plan that you had in Fall River will get canceled, because now your zip code is different. You don't qualify for that plan.
Yeah.
So,
What happens so say I'm a patient of Dr. Jonkis and I go in and he changes all my meds around 6 months after I signed up for everything, and now some of my meds aren't going to be covered. Can I go select a different plan, or does that only happen once a year?
no, good question. There are, now in Massachusetts, there's what's called Prescription Advantage.
Okay.
Now, that titles you for what's called a SEP. If you qualify for Prescription Advantage, almost everyone does,
Okay.
it entitles you to change your drug plan.
Okay.
It used to be every month, now it's every quarter. Or if there's a catastrophic situation where you come down with an illness and your drug now all of a sudden raise a catastrophic level, there's also a way to do that as well. But there are loopholes.
Yeah.
And again, that's where you sit with an agent. Hopefully, they can help you with that. But that would be very difficult to navigate on your own.
Oh, yeah.
So,
Dave, how about drugs that are infused, like chemotherapy drugs and that? What are they covered under? What part?
well, that's it depends on what plan you're in. But yeah, some of those chemo drugs are not covered by Medicare. So that's important. To sit with the right person to get that information. And if that's something that changes throughout the year,
Right.
then sit with someone and they can hopefully work you through those loopholes.
So let's make believe, for example, Nancy comes to you and she's going to be turning 65. How would you approach this situation? Let's make believe she's a customer of yours.
Okay.
Maybe we could do a little bit, you could talk
Sure.
a little bit about how you'd approach that situation.
just with me coming in because
Yeah.
I have to.
Yeah, you're gonna be
Oh, yeah, so
I'm
say,
gonna pretend I'm
Okay,
really
and
sitting
Nancy,
with you.
so Nancy has a couple medical issues. What do you got? You got, let's say you have hypertension, diabetes, and high cholesterol. We'll throw those out there.
Okay.
She's on, 4 meds, on, 3 generic, 1 is non-generic.
Yeah.
What's your process in approaching her? How do you look into this and figure out, what's best for her?
so we would
And I'm
obviously,
gonna just throw one other thing in
Yeah,
there
sure.
too. So I have Harvard Pilgrim right now,
Okay.
and I say I'm like totally satisfied with that, and I just want to feel no impact. I want to slide into Medicare
Mm-hmm.
with everything that's happening now because I like my plan so much.
Yep.
So yeah,
So I would sit with you and we gather some personal information, and when is your Medicare going to be into effect?
okay,
Okay, then we're gonna say, who are your doctors?
okay,
What do you have in place now? Who are your doctors? What meds are you on?
okay,
And from there, if you love Harvard Pilgrim Health, okay, let's look at, I can show you what Harvard Pilgrim Health has. And you say, okay, I like that, let's go with that. It's a simple process once you sit with someone and decide what you want to do. But I'm gonna gather the information. I might ask you some health questions regarding your lungs and your heart. But
sure,
other than that, your meds is a very important one,
okay,
and who all your doctors are. And then financially, if you can afford a supplement and you want peace of mind, and you say, I want to go supplement side, you can.
is that what they call Medicare gap?
That's a Medigap policy,
A Medigap.
exactly. So you're paying for that gap. So you pay so much a month and you have no gap.
So how much are you taking out of my wallet?
Well, in Massachusetts, an average of anywhere from 180 to 225, depending on what company you go with, per month,
Okay.
plus the Part B. The 148, right now is Part B, you pay 148. The only way to eliminate the 148, you'll see that in the commercials as well.
Okay,
That's as if you're on Mass Health in Massachusetts or you're on Medicaid in Rhode Island, meaning you're low income.
But just so everyone out there understands, Dave, his service, there's no charge for that. So,
Right.
no, people who come to Dave or persons who are doing this type of work to help navigate through Medicare, there's no charge, which is a great service.
Right, so I would get your information, find out your doctors and your meds, and okay, well, let's take a look. You like Harvard Pilgrim? I'll show you what Harvard Pilgrim offers for you.
Okay.
You say, okay, that looks good. I'll show you what United has,
okay,
Fallon.
okay.
And you decide which one you like. If you like Blue Cross, I don't represent Blue Cross in Mass, but if you think Blue Cross is the best plan for you in Mass, I'll find someone to help you with Blue Cross.
Well, I know for me personally, once I move into like that fixed income
Yep.
age, I'm going to be super concerned about costs and everything. And I'm always like, let's kind of play out the worst case scenario and what's going on. and
That's
what's
why
going on.
you ask a few health questions. Have you been in the hospital? How often are you in the hospital? So then you can gauge, does someone maybe fit supplement?
Okay,
Well, you're gonna pay so much a month, and no, I'm not gonna. No, for example, I had a woman come in. She was 65. Looked at the supplement Advantage, and she said, "Oh, my mother's 90-something years old on an Advantage plan, but she's been in the hospital every month for the last 3 months." I go,
Okay.
"We should put her in the $225 plan, where she'll pay $225 a month, and that's it."
yeah.
Right.
So she was 90-something years old, very ill, but they don't ask any health questions in Massachusetts, so you're allowed to do that.
Right.
Now, for yourself coming on, you can go into a supplement plan. Down the road, if it doesn't fit your budget any longer, you can move to the Advantage plans.
At any point during the year, is there?
Well, there's special election periods that you
Okay.
can throughout the period, but we know how to get those loopholes for you.
Okay,
The prescription advantage is a big loophole in the state of Massachusetts.
okay,
According to Medicare, that's giving you what's called extra help.
okay,
There's also an extra help when it comes to your drug plan. People will hear that, do I get extra help? That's a low income subsidy,
okay,
which we talked earlier about this. Someone who's on insulin, they'd be paying $50 a month for their insulin. This
Right.
puts a ceiling on what they can pay for any brand name drug. $8.60 or to 90 cents, something to that effect at this point.
Right.
But it puts a ceiling on what they're gonna spend for the drug, so. Another area when we ask information, okay, maybe you might qualify for this, let me help you enroll in this program. We try to save you as much money as possible.
So Dave, if someone, just goes to the Medicare site, they're gonna put in there, they do ask medications and that, but all they're gonna tell them is, well, here's 15 plans that you can be part of, essentially.
Yep.
it's not gonna lay it out as nicely. It's not gonna say, well, this is the upside and the downside to each one of these plans. And that seems like where you're really coming in. It's more personalized to the customer, to the
Right, because,
individual.
it's something I do every day.
Right.
Where you're going to look at it, you're not looking at, if I go to Walgreens, it may cost me this much a year, but if I go across the street to CVS, I may save a lot of money.
Right.
That's where you gotta do your due diligence, and that's hard to know if you don't do it every day.
Yeah.
So,
You know, it's nice too. Like, I typically have like 20 million questions, you know?
Yeah.
So instead of like searching around, like for me, when I looked at the Medicare.gov site, I thought it was great and very informational, but I would be searching around a lot throughout that site. So it's kind of nice
and
to
right,
just
and
say,
as you know,
listen.
and why I'm here is because,
sorry.
That's okay, I'm just gonna move
Medicare,
it closer.
Medicare is confusing.
Yeah.
So to go ahead and do it yourself, I mean, you can, but it is confusing, and you wanna make sure you're in the best plan possible.
Sometimes we hear about penalties if you don't sign up for a drug plan. Can you kind of talk about that?
Yes, certainly, that's the Part D plan.
Okay.
Again, a voluntary program set up by the government, but if you don't voluntarily take it, they're gonna penalize you. But again, that's something you wanna be concerned about. It's a penalty, you don't want that.
So
Right.
even if I'm
Someone,
not on drugs,
someone who, what you'll find a lot, you'll find people who are 65,
Yeah.
healthy, not on any prescriptions.
right,
I don't need a drug plan.
Right.
right,
Now they're 70,
And
and
they
they
need a
got
drug
ill,
plan. Yeah.
now they're on drug, they need a drug plan, so they've been 5 years.
Yeah.
right.
You get charged 1% for every month you did not have a drug plan.
1% of what?
1% of your drug cost. So now, yes. So if your drug costs $1, you're paying $1.60 because you're getting charged that 60% extra for those 60 months that you did not have
It
a
really
drug
adds
plan.
up.
But again, that's
And is
where
that
you,
forever?
until you file a low-income subsidy. If you know
Okay.
how to do that, that will eliminate most of your penalties.
Okay,
The Part B, there's also a penalty for Part B if you don't sign up at 65 and you didn't have credible coverage.
okay,
Same thing. So if you're gonna continue working, when you decide to not work, there's certain paperwork you need to file to turn on your Part B, and another one goes to your employer that they need to fill out to say you've had credible coverage from the time you turn 65 until today, and you're gonna retire, so you won't incur any penalty. We forward that to Medicare, when that time comes when you're gonna retire.
You help with that paperwork.
Yes,
too.
exactly, yeah.
That's
And
great.
again, that's where it's important, get all your ducks in a row.
Yeah.
We try to make this process as simple as
I mean, this
possible.
paperwork's a big burden for a lot of people. It's difficult to navigate and get through and
and
figure
just to
out what
have
they
that
want.
like feeling that you're doing everything right,
Yeah.
you know,
yeah.
because you don't want to mess up on this stuff and then
Well-
find out when you're sick that you don't have the coverage
Yeah.
that you thought you had.
Especially today, a lot of people are waiting till their full retirement age, which
Right.
is now 66 in 2 months, 4 months, 6 months. So
Sure.
people are waiting till 66 and they keep working.
Yeah.
So that's why it's important when you decide to go on Medicare to file a proper paperwork
Right.
in a certain amount of time to get everything turned on.
So, if my husband knows he's going to wait till he's 70 to start collecting Social Security, but he'll stop working at 65. He's falls into that group where a couple of months before he turns 65, he's sitting with you and you're discussing all these
Exactly.
plans and everything.
And if he's going to continue working, and even not, but not collect,
Yeah.
they will bill him for his Part B on a quarterly basis.
Okay.
Very important to pay it, because if you don't want your Part B to get turned off.
For-
Once you start collecting, it comes out of your Social Security check automatically.
What's the most, and I don't know if this is a question you can even answer, but what's the typical cost for everything for like Medicare Part A, Part B, and like drugs? What's kind of like the average?
What are people paying in average?
Yeah,
Yeah.
well, Part A, again, is free,
Okay.
unless, there are some municipalities that, some school teachers didn't pay into the system.
Yeah.
Part A costs $480.
Wow.
So if you didn't pay into the system,
$480 a month.
$480 a month,
Yeah.
plus Part B is either $148 or higher, depending on your income.
Okay.
Okay.
So those are that covers your Medicare.
Right.
Okay.
And then you decide what you're going to do from there, as far as your coverage for that 20%. But if you're
Right.
not going to go on Medicare at 65, you got to do the proper paperwork when the time comes.
Okay.
Right. So I heard, I'm I'm thinking about me. So if I paid into it, my Medicare A is free.
You
My
probably-
Medicare B is going to be somewhere around 150, 140.
Whatever your income was 2 years prior.
Okay.
So you retire at 69, whatever you earned in 19, when you were 67, they're going to look at that
Okay.
to decide your Part B cost.
Okay.
But that still doesn't cover that 20%.
No.
Then you
Right.
need,
Then you're going to get a supplemental. You don't have to, but I would recommend a supplemental or an advantage plan.
So then, if we talk about like one of the most common supplemental plans, what am I adding to that 148 cost?
200
200
plus a drug plan. Now, again, the drug plan will depend. An average drug plan is $800 for the year between the cost of the plan and your co-pays for your drugs.
yeah. So
So in Massachusetts,
up.
you could easily have a supplement plan and a drug plan and paying close to $3,000 a year,
Okay.
and you have no dental, no vision, no hearing.
right.
You got to go get that separate.
Is that-
The Advantage plan gives you all of that. Covers your drug plan. Is included in the Advantage plan for no cost, but you pay co-pays as you go pick up your drugs. And in the Advantage plan, yes, your doctors and your hospital and everything is covered, but they give you the free stuff, the dental, the vision, the hearing, the gym memberships. The
Do you
health-
have to stay within network?
Yes, the health products. That's why we ask, who's your doctor?
I see.
Who's your doctor? Who's your specialist?
Mm-hmm.
Starts with your primary. And then in the booklet, you can look up their medications.
So it
No.
doesn't sound like Medicare Advantage is too different from a lot of health plans that people are in.
Are used to.
Right.
That
Yeah.
you
Because
have
we're
your
all,
little
we're all
community.
accustomed to paying copays
It's
now.
like an
Right.
HMO, basically,
Right.
it sounds like.
Yeah.
Almost.
Right. So, yeah, because we're all accustomed to paying copays now.
All right.
Dave,
So-
I'm sorry.
oh no, go ahead.
Dave, I just want to maybe switch gears a little bit because we talked about this before, and I think this is something many may be interested in, is the SCOs, which is Medicare and basically Medicaid.
And Medicaid,
Yeah.
yeah.
Can you talk a little bit about that? Because I think that's a fascinating product, and a lot of people don't know about it. There's a lot of great coverage with it also.
What did you call it?
It's called a SCO.
That's
Dave will
called,
explain it.
that's called the senior care option. Those are special needs plans. So typically it's someone, well, not typically, you have to be on Mass Health. For a SCO, you have to be on Mass Health, and you have to be 65 years or older.
Okay.
So basically what it does is you get a plan for free, zero co-pays anywhere you go, and it gives you that, it covers your drugs, and it gives you, because you have very low income. So it's helping people who have very little get a lot of help with Medicare, so which is good.
Yeah.
So everything is paid for, and it gives you the extra, like the SCO plan in Massachusetts, you get free dental, unlimited dental,
Yeah.
which is important for your health. So
Sure.
and
They're great plans. I mean,
Yeah.
so, for our viewers out there, if you're on Mass Health and you're getting to that Medicare age, this is something to consider. I mean, they cover a lot more than just straight Medicare.
correct. And then, there are different levels of Mass Health. So again, that's where we come. If I sit with you and I say, okay, maybe you're a candidate for Mass Health, we can call Mass Health. There's an automated system that your answer tells you what, are you on standard? Are you on common? Are you on whatever? There's like 3 or 4 different levels. So it tells you right there in automated what level you're at.
The other thing you told me, which I thought was really a great service, is that you'll fill out the Mass Health application, which is a very
That's
onerous
overwhelming.
application. I mean, how many pages is that application?
Well, in Mass, it's like 34, Rhode Island's 40-something pages. And, not every page pertains to them, so
Right.
it is overwhelming, but...
But if you go to a lawyer and have it done, it's thousands of dollars in some instances, and it's hard to get through it on your own. We've had a lot of patients at the nursing home who try to do that, and they generally need help. It's difficult. It's not as simple as you would like. So that's a great service.
Right, and I mean, again, now it helps people because now they're going to get into a plan specific to their situation.
Right.
It's going to save them money.
What, if I'm navigating this for a parent, how far can I go just me without having my parent? Like, how do they?
Well, that,
Yeah.
that-
If
Can
I'm
you
doing
can you
everything
can you do this
online.
as can a child help out to do this?
Yeah.
for
Oh,
their-
of course, and we encourage that as well because someone's 65 and is different than has all their faculties. Someone 65 may not.
Right.
So and it's maybe they're not doing it until 70.
Mm-hmm.
So and maybe they don't have everything, and the children are worried about it. Yeah, we encourage them to come in.
So do they? That's a great point that you bring up. If they're struggling cognitively, I don't need anything notarized or anything like that. I can just kind of sign up for my mom.
Well, again, now, if you're in an appointment, you recognize someone may have some issues, you got to ask those questions.
Yeah.
Do you make these decisions to yourself? Do you have someone that,
Yeah.
Right.
and then if you suspect that, is there someone I can talk to? Do
Right.
you have a daughter or someone I can talk to? Then talk to them. I mean, that depends on the agent,
So it's still an easy process. It's not like I have to go get a bunch of
No,
stuff.
no, it's encouraged, it's helpful, and when you're talking to, if you're talking to the carrier on the phone,
Yeah.
they're gonna ask your mom, is it okay if your daughter speaks on your
Sure.
behalf? Yes, that's fine,
Okay.
as long as they hear that voice come in, it's fine. But it's encouraged, because you wanna know what your parents have,
Right.
because again,
Right.
at the end, it's gonna fall on you, so.
Oh, yeah.
You wanna know what your parents have and if it's the best plan for them.
Whatever plan someone chooses, does it automatically renew every year, or do they have to sign up again?
Yeah, typically if you don't do anything, you will just be enrolled in the plan you were in prior.
Okay.
But there is a open enrollment, what's called the annual election period, which is from October 15th to December 7th. That's when everyone has an opportunity to change their plan.
When's that date again? I'm sorry, Dave.
October 15th
Okay.
to December 7th.
Okay.
So at that, that's tied to your drug plan. That's what you're changing, is your drug plan. But almost every Medicare Advantage plan, your drug plan is included. So that's when people explore their options with their Medicare Advantage plan.
Dave, how often do the plans really change? Like, does a brand new plan come out and it's like
Every year,
Really?
well, because
It's
there's a lot of
that-
competition. A lot of
yeah.
competition. United, Harvard Pilgrim, everyone's offering this free, that free. So,
Yeah.
there is a lot of competition. So each year, I have to do certain licensing, certain requirements for Harvard Pilgrim, United, every company you represent, you have to do.
So if I'm meeting with you initially and we have the perfect package called out for me in 2021,
Yep.
2022, it sounds like I should be back sitting across from you and kind of just reviewing everything.
You should do it every year, even if you're not sitting with an agent. But if you're sitting with me, that's my job.
Okay.
If I know I put you in such and such plan last year, and this next year is going to be a better plan, I'm going to call you
Yeah.
and say, before someone else calls you and says, hey, this is the better plan.
Like Joe Namath.
Right. Well, and you laugh, but you hear a lot of people will call and say, hey, I see Joe Namath saying I can get this. Well, I get that, but okay, that's different for everybody. But if people are inquisitive, they're going to call that number.
Right.
So if you don't call your clients and say, hey, I know you're seeing this commercial on TV, unfortunately, you don't qualify. Well, you may qualify. Let's get back together. But at least you want to cover.
Do a lot of people qualify for the Joe Namath plan?
Uh,
Because it does sound so good
well,
on
because
that
you see him
commercial.
all the time,
Yeah,
And
yeah.
he's obviously a popular
Right.
figure, and everybody knows him. So
Right.
and
So
he does a good job. So I mean,
Yeah.
selling the commercial. So, but
So most people that call up will get exactly what he says they'll get.
well, it depends on your zip code. Like he says in there. Now he's very general.
Yeah.
Again, now in Massachusetts, if you're in Berkshires, it's different than you're in Bristol County. There's different plans depending on your zip code. Rhode Island is just basically one zip code, but Massachusetts, there's
Yeah.
different areas. The islands, different plans are available out on Martha's Vineyard in Nantucket. So, yeah, it depends on your zip code what's available for you.
Yeah. It's unfortunate. It's so complicated. It's a difficult thing to navigate. It
Right,
seems.
and again, now if someone who's 65, 70, and maybe they're married, and either the husband or the wife did everything, and now one of them is gone,
Right.
Yeah.
that's you run into that. Now you
Right.
get someone who didn't do any of this,
Yeah.
and now has to do it on their own, and it does become overwhelming.
Well, when you're employed, you may have 2 or 3 plans to pick from different tiers. It's easy. There's not really much to think about.
Right, and
you
you have
know,
somebody there usually that can help.
Right, but once you get into this, there's, like you say, there's no human resource department. I guess that's you.
Right, that's us. But again, we discussed this earlier.
Right.
People are skeptical
Right.
because there's so many scams.
Well, I
So it is
mentioned that
hard
to
to
Dave.
get in
Yeah.
front of people.
Right.
As many people as you can help, it is hard to get in front of them because they're worried.
What are some of the scams that you're aware of? Just
Well-
to educate people that are trying to.
I mean, I hate to use that word scam.
Yeah.
It's really, everybody uses it. I don't know of any
Yeah.
that come up, but people do call.
It's probably people trying to get information, want to get your date of birth, your social security number, that type of stuff, who aren't legitimate.
Right.
Yeah.
I
Right.
think
Like
that's
when
it.
you call that number that the advertiser, whether it's Joe Namath or whatever, Kelsey Grammer does them too, whatever's doing the commercial, you call that number, they're legitimate companies.
Yeah.
But there are people calling you
Right.
that are probably not.
Right.
I don't know. I don't know of any, but it happens. We know them. You hear about them,
Yeah, there are a lot. It does occur.
and it happens with the elderly.
Right.
So that's why, again, going back to the children. Again, if you go in and you suspect, maybe you should ask one of the kids. Do you know exactly what your mom's doing here? Bring them in if you think there's some issue there. Bring the kids in, if you can. And then some people are alone.
Yeah.
Some people are totally alone. So it's a rewarding job because you get to go in and help people.
Yeah.
It's
I
very
would think
rewarding.
so.
for sure.
Yeah, that's great.
And help them during a confusing time. I mean, like even me, who's in the healthcare field, I know it would be overwhelming. For
And
me to just
personalities
kinda
are
look through.
different. You got somebody who's a warrior. Oh yeah, they're really worried about it.
Yeah.
So everyone's different. That's where I come in and try and say, okay, I'll help you. Going
Right.
forward, we discussed earlier. Going forward, if you come in to me and you're in the Blue Cross plan, and I think it's the best plan for you, I don't represent Blue Cross in Mass, but if you got an issue, call. I'll help you. But if it's you come in and you're in Harvard Pilgrim, and I think it's still the best plan, I can't put you in a better plan. Now you have a resource with Harvard Pilgrim, so you can give me a call, and I can. If you have a question, you don't want to call them. It's going to be an
Right.
800 number you're going to deal with.
Right.
So
Right.
that's where I come in to you try to help.
You get a lot of that. Do you get people who call you afterwards and say,
Yeah.
my doc wants to put me on this therapy. Is it going to be covered, or things such as that? And
Well,
you have to-
you'll get people who will call you over the least little thing. Some people you never hear from again,
Yep.
no matter what happens. So it depends on the individual. But yeah, I mean,
But you're available.
circumstances come up.
Yeah.
People call. Yeah, now typically, anybody calling me, I typically will call you back within 24 hours. But if I'm sitting with someone in the house, you're not going to answer the phone. So
Right.
you know what I mean.
Dave, what are the biggest surprises for someone like when they transition from like any kind of commercial plan, I guess,
Yeah.
into like Medicare?
Well, you can-
what surprises them? Like what or catches them?
You could save a lot of money on Medicare.
Yeah.
If you're an individual, self-employed, paying your own, you're
Sure.
paying, $1,000 a month.
Yeah.
Yeah.
And if you're not making over $85,000, you're going to pay $150
Yeah.
and get a plan for zero, with your dental, your vision, your hearing. I get a free gym membership for zero. I'm going to pay $150. I'll just pay copays as I go. I'm already paying copays, so you can save a lot of money. Depends, That's why that's where I come in. So, and I ask those type of questions. What plan are you on now? How much are you paying? Because that all makes all depends on do you go on Medicare? Do I continue working?
Is that made obvious? Like all the little freebies, like you've said now a couple of times, free gym membership. Does everyone like know that when they sign up for
No.
stuff?
No, because they don't think it's true. Because they think if it's we were told all our life it sounds too good to be true. It usually is. So, but yeah, the free gym membership is great.
Oh yeah.
That's nice.
Well, again, think about this. Medicare Part A is $480, close to $500. Part B is another $150. Medicare takes that $650, gives it to Harvard Pilgrim or United or whatever. Take Nancy on. Nancy's now your client. Nancy's not spending $600 a month in healthcare. So they're getting $600 every month per person.
Right.
So that's why they can offer the free
freebies.
dental, the free vision, the free hearing. So I mean, it's a great business. It's 10,000 people a day are turning 65 in this country for the next 10 years.
Huh.
So that's why you see the commercials. It's a big business.
Yeah.
But again, people have to have. You don't have to have it, but typically you have to have it, and you want to protect yourself for that 20% the best you can.
So then let's go back to the person who is collecting when they're 65 Social Security, and they just tuned out the whole insurance thing. They just didn't do
Yep.
anything, didn't catch themselves. What kind of plan do they end up on? Because they seem like they would be automatically enrolled.
Well, most times they will be automatic. I won't say it is automatic, but most times it is, and
Yeah.
they will be enrolled in Part A and B.
Okay.
And if they do nothing from that point on, they're on what's called original Medicare.
They'll have that 20% that they have to pay if they have
Well,
a doctor visit or a hospitalization for the consultant costs or whatever procedure is done or whatnot.
exactly. And then most times if you don't have a health issue for a number of years, you don't experience this.
Right.
I'm all set. I don't need to do anything. Then
Right.
at one time, you get hit with a 20% copay.
So can we just go back? We talked a little bit about the Medicare Advantage plan. Can we just kind of go through what people perceive as pros and cons to that plan?
Sure. I mean, the pros are you pay zero or you pay very little per month.
Yeah.
toward the plan. The cons are the copays. If you get hospitalized, typical plan in Mass, you're going to pay anywhere from $350 to $370 per day
Right.
for days 1 through 5.
Okay.
So you're talking $1,800 if you have a 5-day stay at the hospital.
a big
But after
drop.
day 5, it stops.
Yeah.
So that's the drawback. The $1,800. Same thing with nursing home. Medicare is going to cover you for the first 100 days in a nursing home.
Yeah.
After that, you're on your own. Same thing with the Advantage plan. Same thing with a supplement plan. So that the drawback is you're going to pay copays with that as well.
Right.
The drawback is the copays. That's all, and
Yeah.
and maybe the network. Now I
Right.
have to follow a network.
Yeah.
But there are a lot of there are
email.
PPO plans
Yeah.
where in Massachusetts PPO plan you can go to any Mass hospital, you can go to any Rhode Island hospital.
Right.
So that's a beauty of that. So the Advantage plans have a lot of advantage, but yeah, the drawback is the copays. So
Sure.
if you could get hospitalized and get hit with close to a $2,000 copay.
Yeah.
So most people today don't have that. So that
Right.
is a drawback.
Right.
But they don't have the $200 a month to spend on a supplemental plan as well.
Dave, are there like always stuff that you do, or like never stuff that you should do? Like with the extremes on those scenarios, like you would always say X, Y, and Z, or you would like never do this, or this that
Well-
you kind of see people do.
I'll say, well, the first thing you would always, as I mentioned earlier, always find out who their doctors are
Yeah.
and what medications they're on.
Yeah.
And I would never just say, I want to switch to this plan. Can you sign me up? Well, I can, but I want to make sure. You don't want you to call me 3 months from now and say that plan you put me in, my doctor doesn't take it. Well, you told me to.
Yeah.
So I'm going to look before. Even though
Sure.
you say I want this, okay, let me just make sure it makes sense.
Yeah.
But yeah, I wouldn't always and not. I don't know. That's a tough one.
Yeah, that was this. So this past year, or like the past 2 years, have you had a client come in? And can you talk tell us a little story about a client that really benefited by sitting with you and talking through things like, what had they chosen that maybe you definitely had a better plan for them to go on, and what was the savings with that?
Well, I don't really have a specific case to that. I will bring back the woman who came in who was 65.
Yeah,
Her mother was 95,
yeah,
and who was on the Advantage plan, paying 100 or 300 every other month because she's have a
Right.
lot of hospital stays. Putting her into the supplemental plan.
yeah,
So that there is about the difference between the Advantage and that, and no pun intended, the advantage of being a Mass resident.
yeah.
You can go to that supplement plan without any health questions asked. So,
That's a big
Yeah.
deal.
Yeah.
Absolutely.
So then, Dave, if Chris doesn't have any more questions, as we start just kind of closing up, what would be the biggest message that you want to get out to people listening to us? And then how do they get in touch with you if they just want to continue this conversation, or they have more questions? So,
yeah, certainly I would encourage anyone who has questions about their plan to call and make sure you understand exactly what plan you have and are you taking advantage of all the benefits that are available to you. Like the health products benefit. If you've been on Medicare for 3 or more years, I think this only came out 3 or 4 years ago, you're not aware that you have these products available to you. Maybe you are, but I mean, if you haven't sat with someone that explains that to you,
right.
so I would encourage someone to do that. If you want to get in touch with me, I am located at 111 Taunton Avenue in Seekonk, right on the East Providence line. My phone number is 774-930-1826, or you can call my personal cell phone number, 508-717-4097. And I'll be more than happy to answer any questions you have right over the phone. And you just want to make sure someone is in the best plan for them.
And they can come to your place, but you also do some house calls, it sounds like.
Yes,
also.
exactly. Up until last June, before I opened the storefront location, that's we would go to your home. And it was kind of coincidence with the COVID situation. And, it's easier to have someone come to my office because I can clean everything after each person leaves. I mean, if you don't have any hesitation of me coming to your home, or maybe you got logistics problems, I will go to your house as well.
Oh, that's
And-
great.
Or we can meet, if you're not comfortable with either one, we can meet at a neutral location, like a Panera Bread or Dunkin' Donuts. Well, Dunkin' doesn't let you sit inside yet.
Right, right.
But, a
Let's go
place
to
like
Chris's
that,
house.
a situation like some people
Yeah.
don't want you coming to their house, that they're not
Yeah.
comfortable coming to the store.
Yeah.
Let's sit at a central location.
So very accommodating.
Yeah, so we do whatever we can to get in front of them to try and make sure they're in the best plan possible.
Perfect.
And there's no charge, which is a great feature
Yeah,
also.
our service is
Yeah.
always free.
That's great. And Taylor, you'll pop all those links for Dave up on our social media sites.
Right after the show.
Great,
Great.
excellent, excellent.
Great. All right.
Very good. Well, thank you, Dave. This has been great. I think it's been really instructive to our viewers. I certainly learned a lot. I'm sure you did too.
Oh my
Nancy.
God.
Yeah.
I feel better. I feel better that there's someone that will look out
Right.
for me. You know?
you worry about this
'Cause
stuff.
I'm just- I know.
worry
I
about
don't
it.
know what I'm doing with
So
Medicare.
once again, thank you, Dave Gering. Wonderful, wonderful discussion. We appreciate it. I want to also just a little recognition to our sponsor again, Bay Coast Bank, which is just right for all your financial needs. And you can visit baycoastbank.com or call 508-678-7641. Dave, do you want to give your number once again?
Sure, 774-930-1826, or you can call my personal cell, which is 508-717-4097. And I'll give a plug to Bay Coast. We are located right across the street from Bay Coast Bank.
There you go.
On Route 44.
Excellent. And Dave, once again, is from Medicare Made Easy, and this is really a great service. Thank you very much. And we'll get that information out on the site later on. So if you don't have a pen to write down those numbers, don't worry, it'll be up later on. So once again, thank you. And thank you for listening to and viewing the 27th Degree with Chris and Nancy from 27 Degrees Consulting. I want to point out our new backdrop also, Mount Everest.
Oh,
which,
yeah.
Yes,
which
very
is
pretty.
great. And our new logo, the more linear 27 Degrees logo, we have a new website that's up now too. Please check it out, 27degreesconsulting.com. Thank you very much, and everyone have a great day.
Bye now.
Thank you.